In the clinic, you're probably going to come across an individual with a shoulder injury where you need to determine, is it necessary to get imaging, or potentially the patient's just asking, should I get imaging? And I think this often goes back to our conversation of, is imaging necessary to get adequate diagnostics and perform a safe, efficient, and effective plan of care? Or is it going to be geared more towards prognostics and being able to more accurately forecast what this patient's plan of care looks like? The need to forecast is often going to be timed with the sense of urgency that they have. And is this something that is a low symptom profile, not all that functionally limiting, and there's no sense of urgency with regards to the patient needing to have information for them to go back to activities of work or daily living, or maybe it's just not limiting that much and it's been more of just a nuisance and an annoyance, there's probably a lower need for imaging in those scenarios. If we have an individual that has a high symptom profile and they often have maybe limited functional ability, hindering their ability to work, do activities of daily living, or do leisure activities, or maybe they have something approaching in the near future and their ability to participate in that is compromised, that would put somebody in a higher likelihood to require or benefit from medical imaging. But if we're talking about shoulder injuries in general, some easy guidelines that you can use, and this is not an exhaustive list, this is not an all-inclusive list by any means, but just things for you to consider where on the spectrum they are of highly needing medical imaging versus not all that urgent to need it. Think of these different considerations. And I think the easiest one is, first and foremost, consider the mechanism of injury. How did these symptoms come about? How traumatic was the injury? How specific was the cause of the injury? Is this something that happened from a fall? Did it happen from direct trauma? Did it happen from a motor vehicle or maybe a significant work-related accident? If there's a high force or high impact trauma or just a more severe specific mechanism of injury, probably going to put them more towards the side of potentially needing imaging, especially if there is a bout of instability associated with it. So a subluxation or a dislocation, definitely a dislocation. If there's reports of a subluxation and maybe even recurrent subluxations, then that's going to make me more prone to think that they would benefit from imaging, just to see structurally what are we dealing with and what do we have at our disposal to work with in regards to tissue quality, bony integrity, things along those lines that may limit our ceiling or our floor for potential and recovery. Next, you want to consider their symptom profile. Is it relatively predictable or is it sporadic? Is it low intensity or is it high intensity? Is it something that they have any means of mitigating and reducing, or is it completely out of their control? And if this is somebody that has a higher symptom profile, it's very unpredictable, it's very persistent, and they have no means of getting it to reduce, then at the least, you're going to refer them out to another medical professional just to see if there's anything on top of what you're providing that could benefit them from a symptom relief standpoint, and potentially also imaging as well to get a clearer picture as to why this is happening. And third, what's the functionality of their shoulder and really of their upper extremity look like? What does their range of motion look like? What does their strength look like? What does their movement quality look like? And this is going to be a little bit vague because some of this may just have to do with how symptomatic they are, whereas some of it may have to do with structurally, what do they actually have intact mechanically to work with. But those are the three big factors. What was the mechanism of injury? What's their symptom profile? And what's their functional status look like? When you take those three things and you combine it with the sense of urgency that they have, that's going to help make you make more educated decisions as to the need for imaging. Now, with sense of urgency, keep in mind is that a certain time frame that they're dealing with a definitive event that's about to take place that they need to participate in or know their status for, but also just a general quality of life. And is it impeding their ability to enjoy and perform their activities of daily living, to perform and function at a high level in a work capacity and enjoy going to work, and just other day-to-day interactions from a leisure standpoint. All of those different factors are going to influence really what their sense of urgency is, and potentially even their desire to get imaging. Now, how you communicate to them what you are going to gain from imaging is important as well. So, depending on their mechanism of injury, their symptom profile, their functionality, what you've gathered from their subjective and objective data, that's going to give you an idea of how likely is this person to recover just with time and with intentional interventions on our end, versus how limited are we going to be with what we can confidently and safely get them until we get more information regarding the status of their injury and what all is likely involved. So I think communicating to them in regards to if they do or do not need imaging or how much they would benefit from getting it, and then also painting a picture for them in regards to is imaging going to provide more diagnostics or prognostics, is going to be beneficial and important for all involved parties.